Okay, let's get back into this with Wilms tumor. It's a pretty rare tumor as far as tumors go, but we'll mention it here anyway because it's kind of interesting. It is also called a nephroblastoma. Okay, and it's like 5% of childhood cancer, so it's rare, but 5% of childhood cancer is still worth mentioning, I guess. Again, it's called a nephroblastoma is the other word for it. Usually you see this right about in between 2 and 3 years of age. When you see this Wilms tumor, most of the times what's happening here is somebody is discovering it, as in the mother usually discovers this thing right about then. Alrighty. Now let's talk about. It is the most common solid tumor, I guess, as far as solid tumors go for happening in children. And they think that some of the reasons may be that before the mother got pregnant, she was exposed to things like pesticides or other toxins. And it's also slightly more common in black children than in white children. Not really sure why about that. Again, it's typically sporadic, as in it just kind of shows up and nobody has a reason for that, although they do know that there is an autosomal dominant inherited version, but that's really rare as far as the amount of nephroblastomas in children go. Most of them are sporadic. So it's really kind of hard to say exactly what's happening. Okay, this is kind of the interesting part here is about 18% of these children, other than having that big nasty tumor in their kidney, they also have some of these other congenital abnormalities. Okay, we'll see a picture of a lack of iris or aniridia here in a second here, which is really, really interesting. But you're going to have, the lack of the iris and the aniridia. You're going to have a hypertrophy, or what that is the body's not symmetrical, so one side is bigger than the other. You're going to have these genital urinary malformations like horseshoe kidneys, or the hypospadias that we saw before with the opening on the penis underneath where it should be. You can have a couple of urethras. Polycystic kidneys can also be part of this. So, I mean, if you have some of these things, then both the congenital abnormalities that I talked about and the nephroblastoma at the same time, that 18%, they're more likely have the inherited form of the disease. Okay, but again, that's more rare, the inherited form, than the sporadic kind of thing here. Okay. Okay, but again, it's mostly discovered by a mom or something. It's just got a big asymmetrical mass somewhere between 2 and 3 years old, and the mom usually notices that. The kid, tends to appear healthy and thriving, and they're doing well, but they have this abdomen hurts and they're peeing blood, and they really, I guess, could have anemia because of that, and fever because of, the infection thing going on there. They might have hypertension. In fact, quite often they have hypertension because that tumor actually secretes renin, and that is, renin increases angiotensinogen, which increases angiotensin 1, which is converted in the lungs with ACE into angiotensin 2, and that increases blood pressure, and it also increases aldosterone, which also increases blood pressure. So yeah, you do tend to see hypertension because of that system, and also because it is a kidney problem, and that's going to increase your blood pressure anyway with any kind of damage to kidneys. So basically a dual problem going on there. But you can catch this thing and treat it surgically. And as far as surgery goes, if you catch this thing, I'll get back to this iris thing in a second here, but if you catch this thing where it's still in the kidney and it hasn't spread anywhere, then you're talking more than 90% cure rate on this one, and even when it does spread, you're talking over 80% cure rate for for this, so it's one of the ones that are fairly well cured. This is a picture of the aniridia. Clearly you can see where there's, this has, it looks like a little bit of iris, but certainly not much, so it looks like a huge blown out pupil there. Okay. What is the primary treatment for Wilms tumor? Okay. Did I even mention that? The primary treatment? I basically just said you want to cut it out. You might be able to get away with radiation therapy, but basically surgery. Just get rid of it. Okay. Signs and symptoms. And I have another, what is the primary treatment? Okay, so review that again if signs and symptoms aren't coming to you pretty fast. Alrighty, and that is all, folks. Thanks for playing.